What can children's drawings tell us? In psychology, the most informative methods for diagnosing children are drawing a person and drawing a family. The child communicates their needs, experiences, fears, and aspirations in a playful way. The norm for children 3 to 4 years old is the image of a person not completely, but only the head in the form of a circle and the limbs, strips extending to the side of the head. The drawing may include eyes, mouth, and nose. Starting from the age of 4, a person is depicted with a torso, but all the elements of the character are not related to each other. At the age of 6, the character's arms and legs take shape and thickness, represented by 2 lines, and minor details appear in the drawing: hair, eyebrows, neck, and clothing. Children of 7 to 9 years of age combine schematic and plastic images. Body parts are connected by smooth lines. The drawing is complete. Starting from the age of 10, plastic elements predominate in drawing. A significant lag behind the age norm in test performance may suggest a lag in intellectual development. If the development of the visual function is ahead of age, you can be happy for the child. You should pay attention to the location of the drawing on the sheet. In the upper part of the sheet indicates an inflated self-esteem, the desire for high achievements. In the lower part of the sheet, low self-esteem. In the corner of the sheet, depressive state, bad moods, goes over the edge of the sheet. Some parts of the drawing do not fit. Impulsivity, acute anxiety. The presence of monotonous details, excessive accuracy of the drawing, underlying control indicate high self-control. The desire to hide from others their experience and problems. The presence of an anxiety in a child can indicate a plurality of lines, shading, and frequent correction not brought to the end of the line. The hands pressed to the body, the angularity and the thinness of the figure depicted, the set face of the depicted character indicate isolation, insociability, concentration of their experiences. The arms and legs spread wide apart. The smile of the depicted character indicates sociability, self-confidence, and a cheerful character. The exaggerated size of the little man's head may indicate a tendency to fantasize and dream. A greatly reduced head size indicates a low value of intelligence for the child. The image of teeth and sharp elements in the drawing indicates a tendency to verbal aggression. Aggressive postures and a raised hand indicates a tendency to use physical force. And the last thing worth paying attention to are the details of the drawing. So, a weapon in any modification is a thing of aggressiveness. Cigarettes, bottles, tattoos, evidence of sociality. Decorations and increased attention to clothes, hairstyle will tell about the demonstrativeness of the drawing. One's scars are indicator of a neurotic state. There are two main points to consider when interpreting children's drawings. You can't make any diagnosis and draw conclusion based on the data in the drawing. This requires additional research using reliable diagnostic methods. You need to interpret not the individual parts of the drawing, but their relationship with each other, and try to put the whole pictures together. You can only seriously analyze children's creations after 4 years. Thanks to everything can be learned from the drawing. You can correct the child's behavior and academic performance, which will allow you to correct the situation in a positive way.